Can you please show my first slide, please? So just as a disclosure, I work at Oncomed Pharmaceuticals, the developer of this drug that I'm about to talk about. And Demcizumab is an anti-DLL4 agent. It affects directly the Notch pathway. It's a humanized monoclonal antibody and has a half-life just like without any other antibody of about 2 weeks. And the interesting part about this drug is that it has multiple mechanisms of action. It's a complex pathway where it has multiple ligands as well as multiple receptors. And we have at Oncomed also other Notch antagonists, and we can see clearly that the toxicity profile or safety profile of these drugs is remarkably different even by targeting the ligand or the receptor. One of the mechanisms of action of Demcizumab is by disrupting angiogenesis. And the second one is by blocking cancer stem cells. So it forces differentiation of these cancer stem cells in both tumor cells that can then be well targeted with existing chemotherapies. And as you know, cancer stem cells are particularly resistant to chemotherapy. And the last mechanism of action that has been recently shown to be quite interesting is that it relieves immune suppression at the tumor level. One of the challenges with immune therapy is the concept of myeloid-derived suppressor cells. And one of the effects of Demcizumab treatment is that it decreases the effect of these MDSCs. So we have a number of ongoing trials with Demcizumab, and that includes one of the studies that we're planning, a phase 1b study where we will combine Demcizumab with anti-PD-1, and that study is supposed to come online in early 2016. What I'm here to talk about is particularly the phase 2 DENALI study, and I'll show you a little bit of the phase 1b data that is in non-small cell lung cancer. So we have seen throughout our development program, we treated almost 200 patients at this point, and we have seen not only single agent activity, but also we have worked through some of the safety concerns that had come to be during the development program, and we developed this what we call this truncated dosing, where we dose only for 4 cycles with Demcizumab. DENALI is now a phase 2 study that is recruiting patients at this time, and I'm also looking for investigators to join the study. And it's looking to recruit patients with metastatic non-squamous only non-small cell lung cancer in first line. The study has about 200 patients. It's an endpoint of overall survival. The chemo combination here is carbo-Alimta, and it's given in the using the maintenance setting, and the study drug is given for 4 cycles or placebo for 4 cycles, and then the maintenance is continued. So a little bit of the phase 1 data. We treated 4 cohorts in this phase 1b study, a total of 46 patients. We initially started with continuous dosing of Demcizumab, where we treated through the chemotherapy as well as in maintenance, and we later discontinued this due to the arisal of cardiovascular side effects. And so we created this truncated dosing where we treat for only 4 cycles, and this is the regimen that we're taking forward in the phase 2 studies. And here is the safety, and you can see that as with any anti-angiogenic, we do see on-target hypertension for these patients. And also, we have been closely monitoring BNP for reasons of, for example, congestive heart failure or edema. And in the beginning, we had a few of these events, and later on, with the truncated dosing, these were much less severe. We haven't seen any grade 2 or higher congestive heart failure events when we use truncated dosing. And here is some of the anti-tumor activity for those doses we saw in the 46 patients that were evaluable for response. We saw about 48% of partial responses, and we saw 88% of clinical benefit rate. So we added the rate of stable disease to these patients. which is quite encouraging, I believe, for this group of patients. And here is the waterfall plot. So we did see responses. Obviously, this is uncontrolled data with chemotherapy, which is known to be active, obviously. But we also saw responses that ranged from the low doses of Demcizumab through the 7.5 milligram per kilogram every 3-week dose that was not ultimately chosen to be taken forward. One of the interesting facts here is that we're now looking at only those patients treated in the truncated dosing mode, and this encompasses 23 patients. The progression-free survival, I don't think it's any not very impressive. However, one of the features that we see here is this tail of the curve that has been much discussed in other types of therapy, and we've been looking at this with significant interest as who are these patients that ultimately sit here at the end of the curve, and who are these patients that are most likely to benefit, and perhaps we can target those patients and find them to recruit to our studies. The other part here is just doing a few exploratory analyses, trying to find predictive biomarkers. In anti-angiogenesis research, predictive biomarkers have been particularly challenging. And one of the things that we saw that was quite interesting is that the patient that had a high percentage of tumor-infiltrating lymphocytes, these patients did particularly well, whereas those that had, the other way around, that had that had high tumor-infiltrating lymphocytes had done particularly well. And the other things, such as expression of PDL or on immune cells or on tumors, and percent of just looking at immune cells, didn't really come out. And obviously, these are small numbers and exploratory, but I think this is an interesting hypothesis-generating fact analysis here. Looking at blood biomarkers, we see that downstream effectors of DLL4 in the Notch pathway are significantly down-modulated. So that includes Notch1 and transcription factors such as NEMO3 and Notch2. So we're showing that the doses that we're giving are able to affect the pathway we're targeting. And also looking at fold change here in other genes. And so we're showing here some angiogenesis genes that have also been modulated. So just to summarize, we have a first-in-class anti-DLL4 antibody that is currently under investigation. I told you about the 3 potential mechanisms of action, so anti-cancer stem cell, anti-angiogenic, and also immunomodulatory. We have now treated almost 200 patients, so we have a fairly consistent safety profile that we think we can take forward to more advanced studies such as phase 2 and 3. And we have some potential early evidence of efficacy now in combination with chemotherapy, and we're still working on predictive biomarkers. So just to finalize, here's our DENALI study. I'll be here throughout the conference. My Chief Medical Officer, Jacob Dupont, will also join us for the next day or two. And we're very happy to talk to you if you're interested in joining the study or even doing some work with the pathway. Thank you very much.
The cardiac toxicity that you saw, did you ever see it late, or was it an early event that you would see and then, resolve?
Right.
Could you describe it a little bit more?
Sure. So this was, it seemed to be an effect of cumulative dosing. And it came around 100 to 120 days after initiating therapy. The events that we saw were fortunately reversible. We've been monitoring these patients very closely, not just with physical exams, but also monitoring their BNP levels. And at the first sign of anything going wrong in that direction, we would stop dosing. Yes, it did. It did. It did not. It did not. So thankfully, these it seemed to be temporary, at least for the patients we treated. Yeah. So the target is expressed throughout the vascular system, that includes the heart. And so if you keep dosing, it seems that the hit is too severe, and and then you don't have that renewal of endothelial that should be occurring constantly in the heart.
So you said initially that this could also target MDSC because of the role of the Notch pathway in MDSC. So
Correct.
did you screen for MDSC effects after therapy, and if so, granulocytic or monocytic? Do you have any information on that?
Yeah, so we have a poster, and I'm happy to share that poster with you that we presented earlier this year. I believe it was at ACR, where we looked at especially these details. I don't remember exactly how this turned out, but there was a particular class of MDSCs that was affected more often than the other. I can say which one it was. I have a 50% chance I won't guess. Thank you.
Next is Dr. Art Kudla, and will be presenting on MM121 targeting HER3 in non-small cell.